Hi, how are you?
Great. And frankly, great news. This is a wow
Yeah, I agree.
podcast.
Yeah,
For the last 25 years, we have been hamstrung by the FDA and
correct.
incorrect interpretation of a poorly designed study about replacement hormones for women. And the misinformation has frightened millions of women and prevented them and others for recommending hormone replacement therapy.
We've talked about it a lot on here. So this
And
is
then-
nothing new. We are repeating ourselves over and over again. But
Well,
what's
what's-
remarkable right now,
Yes, is that yesterday there was an FDA panel created to discuss one aspect of this, but it's a huge start to the whole thing. For a long time, there's been a black box warning on any product, pharmaceutical, that contained estrogen. And some of those statements, almost most of them were wrong. And so the FDA are now looking at, after cajoling by practitioners and patients for years, to remove those black box warnings because they are erroneous, they're wrong.
yeah,
They're basically talking about the increased risk of cardiovascular disease and breast disease with the use of HRT, which is categorically incorrect.
yeah,
And now we've got an impressive panel of men and women, experts in the field, who have said, basically, this is nonsense. This study was misinterpreted. It's been unfortunately grasped by not only the medical profession, but society as a whole, so that estrogen appears to be a dirty word, whereas it is much more accurately referred to, as it was in the 50s, as the fountain of life. The appropriate use of HRT is life-saving.
yeah. Since I met you and we started to have a relationship, this was 20 years ago when we started to have these conversations.
Yeah.
And the one thing you always said to me was, at that time, it's safer to be on HRT than not. So you've been saying this for a very long time.
For most patients,
Right.
that's absolutely right. And so I still see patients that come in with raging hormonal issues, postmenopausal issues, life-threatening diseases that could be avoided and could have been avoided if they had been taking hormones, and still can be helped by taking hormones appropriately.
Yeah, it's interesting. It's like with everything that's out there right now, like you look at Oprah and Halle Berry and Naomi Watts, all the celebrities now are on this bandwagon of
Yeah.
HRT. But we still get so much pushback sometimes from some patients about fear, about their fear.
Yeah.
And
then-
not wanting to, they want to start with the tiniest dose. And then they want to maybe go up a little bit more and see.
Yeah. And
It's almost
this
like
is-
they expect to get cancer overnight from the little bit of
this is
HRT.
exemplified by their primary care physicians seeing that they're on hormones and saying, "Oh, you got to get off those soon."
Yeah.
Because the old thinking was HRT was okay treating hot flashes, night sweats, but that's it. As little medication as possible to achieve that goal, and for as little time as possible. And that's completely wrong.
Yeah.
The vast majority of patients will do well starting early and continuing for the rest of their lives, providing everything else is going well. There is not an increased risk of breast cancer. There's not an increased risk of stroke. There is an increased risk of osteoporosis and the significant problems that go on with that. And as much as anything else, the quality of life is so much better. So this is a big day. And it's not.
We're going to be
often we can
following
say
it very closely too.
We are.
So more to come on this. But I do have to say this, as a friend of mine sent me her lab work this morning, and I said, did your primary care physician talk to you about your lipids and your hormones? And she writes back, no, she didn't say much. She, of course, wants to talk to you, which is why we were chatting. But she didn't say much about it, any of it. What I was looking at was alarming, that I can't even believe her primary care provider didn't bring it up.
Right.
And she's in her mid-50s.
Yeah. Ideal candidate.
Yeah. And I'm sure that's what's happening is.
Yeah. And the other extension to this is that many women, for some 5 to 10 years before they are officially menopausal, have symptoms. And these are very difficult patients to treat sometimes, but there are solutions here, and we can make their lives better.
Yes. No, I'm excited about this. They had a huge panel. It was the FDA and all these very knowledgeable physicians. It was like a 2-hour conversation, and it's on YouTube right now. So you can Google it and watch it for yourself too. So
get the info, ask us questions.
Yeah.
This is what we've been doing for the last 25 years. And finally, some people are saying, yeah, you're right after all.
Yeah, real progress.
Pretty cool.
That's great. Okay.
You bet.
Okay.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.